Welcome to the deep dive. Today, we're going way beyond just sniffles and coughs. We're diving headfirst into the world of ear, nose, and throat.
ENT.
ENT, exactly. And we've got these three fascinating cases. They're from ENT clinical case studies. And you, dear listener, get to play detective with us.
That's right.
So we'll lay out all the clues, and then together we'll try to figure out what's going on.
Before the big reveal.
Before the big reveal, exactly.
Yeah, these cases, they really highlight, I think, all the different kinds of conditions that we see in ENT and how sometimes things that seem really small can actually be a sign of something much more serious.
Interesting. Okay, so let's unpack this first case. We have a 25-year-old man, and he walks into the doctor's office. And he's got this hard, painless lump on the roof of his mouth.
Okay.
It's been there for years and hasn't changed at all, but it's definitely not something you want to ignore. We also know that he's a smoker and enjoys a few drinks on the weekend, so what are your initial thoughts?
Well, right away when I hear those lifestyle factors, you have to think about the possibility of oral cancer.
Right.
But the fact that this lump, it's hard and it's been there for years without changing,
Yeah.
that actually makes cancer a little less likely.
So if it's not cancer, what could it be? Like, can you get a bony growth in your mouth?
You absolutely can. So there's this condition called torus palatinus, and it's basically just this bony growth, a benign bony growth on the palate.
Oh, wow.
It's actually surprisingly common, and we see it a lot more in women and people of Asian descent. We're not exactly sure what causes it, but we think it might be a combination of, like, genetics, maybe some environmental factors, even chewing habits could play a role.
That's so interesting. I mean, it makes you wonder, like, how many people are walking around with Corus palatinus and they have no idea?
Probably a lot.
Yeah, it's not like it hurts or anything.
Right. A lot of people don't even know they have it until, a dentist points it out.
Right. Wow. Okay. So, are you ready for mystery number 2?
Hit me with it.
Okay. This one's a little more intense. So, picture this. You have a 70-year-old man and he has really severe ear pain. So bad, in fact, that it's keeping him up at night.
Oh, wow.
Yeah, he's describing it as even worse than a toothache. And it gets worse when he chews. To top it all off, he also has diabetes.
Okay.
What could cause such excruciating ear pain?
Yeah, so diabetes is a really important factor here because it can actually make it much harder for your body to fight off infections.
Hmm.
And when the doctor examined his ear, they found swelling, pus, even something called granulation tissue, which basically means your body's trying to heal, but when you see that with an infection, it can indicate something more serious is going on.
Like what? What could be going on?
This sounds like a case of something called necrotizing otitis externa. We call it NOE for short. And it's a really serious infection that can actually spread to the bones of the skull.
A skull infection. Oh my gosh.
Yeah, it's pretty scary. It's more common in people with diabetes, and it's usually caused by a bacteria called Pseudomonas aeruginosa. And Pseudomonas, it's known for being a really tough one to treat.
Oh no. So what do you do in a situation like that?
This is definitely a case where you need to act fast. We're talking IV antibiotics straight into the bloodstream
Yeah.
to really knock out that infection before it can spread any further.
Wow. I bet the patient was really grateful they went to the doctor.
Oh, absolutely.
I mean, this case really highlights why it's so important to get any kind of persistent or severe pain checked out, especially if you have any underlying conditions.
Couldn't agree more.
Okay. Ready for our last case.
Let's hear it.
All right. This one's a little less skull infection and a bit more, well, adorable. We're talking about a newborn baby.
Okay.
Picture this. Perfectly healthy baby starts feeding, and all of a sudden, their little face turns blue.
Oh, wow.
Right. But then, just as suddenly, they start crying, and the color goes back to normal.
Right.
What on earth is going on?
Well, that's a really classic sign of a condition called choanal atresia, which basically means there's a blockage in the back of the nasal passage.
Oh.
And that's making it hard for the baby to breathe while they're feeding.
So they're turning blue because they're literally not getting enough air.
Exactly. When they cry, they can breathe through their mouth, which bypasses the blockage, and that's why their color goes back to normal.
That makes...
Yeah.
So how do they even figure out that there's a blockage there?
Well, one of the things they do is try to pass a small catheter through the baby's nose. And if it can't get through the nasopharynx, that's a pretty good indication that there's something blocking it.
Wow. I can only imagine the relief the parents must feel, when they finally have an answer and they know their baby can get help. So what do they do for choanal atresia?
The good news is that it can be surgically corrected. Yeah. They basically go in and open up that nasal passage.
Yeah.
and that allows the baby to breathe and feed